once your tooth falls out, how long do you need to wait to begin the treatment, and how long does it take to complete the whole procedure?
It depends on how or why the tooth was lost. If it had an abscess, was there bone loss? How was the tooth removed? What I'm looking to see is how much bone is remaining, and do I have sufficient bone to place an implant? If I don't have sufficient bone, then I need to bone graft the area. In other cases where you haven't lost bone and the tooth has come out because they've been extracted in a good way, because let's say a root canal treatment has failed, there's been no abscess, no infection, quite often in those sort of cases, you can sometimes place at 3 months. That's called post-delayed. That's when all the activity is going on in the socket where you're going to place the implant. So they say is a really good time to place an implant. Alternatively, you can have what's called a delayed approach, which is 6 months after. So 3 months or 6 months after. But what I would always do is once you've lost the tooth, I would go and get an assessment to see what's involved to replace that tooth and whether you need a bone graft.